Good evening, everyone. You're very welcome to this evening's webinar in aid of Carers Week. This evening, we're going to be talking a little bit about minding your mental health as a supporter. My name is Elaine Donnelly. I'm one of the social workers here in the Department of Social Work and St. Patrick's Mental Health Services. And I'm being joined by my colleague, Niamh Fox, who's also a social worker on our team here. And I'm really delighted to see so many of you trickling in. Just to say in advance, the webinar will be recorded and it will be made available on the website, the carer section of the website, in the coming days. So if at any point during the webinar you feel like you need to take a break or you need to take a breather, feel free to do so, safe in the knowledge that you can come back to this material at a later date. There will be hopefully times for questions at the end, so if you have anything you would like to ask us, please feel free to pop any questions in the Q&A box, and just be mindful to do that in the Q&A section rather than the chat, just so that we can make sure that we get to them throughout the webinar. So without further ado, I'll kick off. We're going to be talking a little bit about family roles, the impact of mental health and mental illness on family relationships, and then Niamh's going to talk a little bit about some of the strategies we have for looking after ourselves through periods of illness, through periods of crisis, and in our caring role. And then we'll talk a little bit about what supports might be helpful for you along this journey. So that'll just give you an idea of what we're going to be talking about today. So this is really to provide a space for you as a family carer or supporter to consider your own needs for support. And we'd invite you to take this space to think about what you need for support, because very often we're not given that. And if we don't give it to ourselves, it's going to be hard to get. It's also to assist you maybe to access information and navigate to relevant services and supports, and ultimately to recognise the unique vital role that families play in times of illness and crisis. And it's important that we recognise that all the time, not just in Carers Week. So I assume for most of you, maybe if you're coming here this evening, you might have a sense that you're in a caring role. Oftentimes that can be difficult to identify, and sometimes people say, I don't really identify myself as a carer or supporter. You know, they're just my partner or my parent, and that's my, you know, role in looking after them. Supporting someone else is sometimes called caring. You are a carer if you provide unpaid support and care for someone who has an illness, a disability, a mental health problem, or an addiction. So even if you spend a lot of time supporting someone else, you might not consider yourself as a carer. So that we often hear that quite a lot. So you might think it's your responsibility to care for your relative or your friend, and you might be providing support other than physical and practical support, which are the more visible supports, but sometimes more straightforward in ways depending on the circumstance. And you might think that the carer role is defined by others, so social services, for example, and more formal care structures. So it's important we start with that, because very often the caring role is invisible, and that's particularly the case if you're looking after or you're supporting somebody through a period of mental ill health and addiction. Sometimes, this is a quote here from a carer, the invisibility of the illness can make it feel like you're not a real carer, and trust me, you are, and you're making a huge difference to somebody else's life. So sometimes that can get in the way of us seeing the caring role that we're playing and some of the support that we're offering. So it's important we start out with that message, that you recognize the role you're playing and you look after yourself in line with that. So we know that family members, and I use the term family broadly, and so nowadays we're using the term family carer supporters in recognition that many people don't often identify with the term carers. Family members are key to people in care and in the recovery of the person experiencing mental ill health or illness. So research would show that family involvement can improve relapse prevention, enhance social support, and improve overall recovery for individuals. Family involvement can also support the family system to manage the impact of the illness and thereby support individual family member well-being. We know that can be a tough road though. We know that families are often trying to deal with complex situations and behaviours without knowledge, without training, without a break often, and with someone they have a very strong emotional attachment to. And that's where things get very complicated. And so we often find that we can talk out suggestions and make plans and strategies, but very often what can make it really difficult and complicated for us is that we have that strong emotional attachment to the person we're caring for. But it's important that we recognise that as families, carers or supporters, your expertise in the person's recovery is really valued and acknowledged. And that's why it's also important that we focus on family recovery. So what is family recovery? Family recovery is about re-establishing our roles, goals, ambitions, and about learning to maintain our own well-being and resilience so that we can continue to support our family members and friends in recovery. So sometimes it can be a bit of a double-edged sword. We know that individuals do better with family care and supporter involvement, and also in order to support somebody, you need to look after yourself first and put on your own life jacket in the first step. What can often make it very difficult to be involved, and I've talked a bit there about families being involved and the value of that, what can often be very challenging, and it's important that we recognise this and we set this out, is that confidentiality and a person's right and to give consent or not give consent we're legally obliged to maintain a person's confidentiality. So there's some exceptions to that. So if, for example, the person has given permission to share personal information, if, for example, there's a risk issue at play, maybe they might be at risk to themselves or to other people. If we're legally required to share confidential information, which can sometimes happen if another person is at risk, and we're required to talk to another health professional about the individual's recovery. So they're just kind of some of the areas in which confidentiality covers, and it's important that we stress that because often people find it very difficult to be involved. Maybe they don't know how to be involved, but maybe the individual themselves hasn't consented for that, and that can be a very helpless place to be as a family member, and it's important we recognise that it's not always that straightforward. It's also important to say that if permission is not given for you to be involved, you can still provide information. And it's also important that you revisit any decisions and agreements regularly. So things can change over time. Sometimes people might say no to information being shared at one time, particularly if they're feeling very unwell or vulnerable, or maybe there's other things going on in the family. So it's important to have an open door around this conversation if possible. I've talked a little bit there about started with some of the challenges, but I think it's really important to recognise that there are benefits to caregiving and supporting somebody. And through this experience, you might feel more confident dealing with other people. You might have a greater understanding and compassion for mental health problems, for example, and you might have strengthened closer relationships to family and friends. Sometimes it opens up conversations and communications that maybe might not have previously been there. It's also important to stress that caring or supporting somebody with their ill health might only be one part of your relationship, and that might make up several parts of a relationship that you have with the person, and it's important to keep that in mind. Notwithstanding, I suppose, the benefits that can be there from the experience of looking after those close to us, we also know that it can be a hugely emotional experience for families when somebody is experiencing mental ill health or addiction issues, particularly at a point of crisis maybe, or adjustment, or time of severe illness. So we know that these are some of the experiences from an emotional perspective that families can go through. So you see a real broad range of emotions: shock, confusion, understanding, anger, loss. You know, it's a real roller coaster of emotions that you might shift and move through over time, or you might move through quite quickly, depending on your individual experience. We know that one of the biggest things that comes up for family members, particularly at the point of inpatient admission, when we're often meeting with families, is a huge sense of anxiety and a feeling of helplessness and powerlessness. So doing our best and trying to find out how we can help and what we can do, but not really knowing maybe what to do or what to say or what works, or how to get the person help, for example. So a lack of information can play a huge role in increasing that anxiety sometimes. It also can be very difficult to navigate role changes or boundaries. Maybe you have to do more for the person, and that might be cause discomfort for maybe you and the person going through the difficulties. Communication, and we'll be talking about this later, a little bit later in the webinar, can be strained for any of us at times of any kind of crisis or difficulty, or difficult problem within a family system in particular. And we also know that sometimes supporters may experience their own mental health difficulties. A big challenge can be knowing when to step back and knowing when to step in. So allow the person to take the responsibility, when to give people a gentle push, when to stay back. Sometimes finding that balance between caring for others and caring for yourself can be a real challenge. So some of the things you might be experiencing, and these are really difficult things to talk about, but it's also important that we recognize that, and that people, hear that they're not alone, and there's very common experiences in terms of the challenges of caring. So some of the thoughts you might have is, you might not think you can help that much, or you might not understand what they might be going through, or you might be worried about what's the right or wrong thing to say. You might be worried about their safety. You might also be worried about what other people think. We know that stigma can be a big factor in terms of how people respond to others with mental health difficulties, and all of us are not immune to that. You might experience challenges in your relationships, or, for example, if the person is maybe struggling with their treatment or finding it hard to get help, they might also push you away, and there might be harsh words or cross words said, that can be very difficult and hard on a relationship, and it may be hard to get them the help they need. So some of the factors that might influence our support relationship is, there's a broad range of them, but it's important to recognize that your own capacity to give support and to be in a support role will be determined by a number of things. So maybe your own emotional state, maybe a history of difficulties or good relationships, the nature and severity of the illness, other things that might be happening in the environment, in their life, in your life, in your maybe family system, for example, and the access that you have to support. So not just maybe other family members or friends, it might be financial supports, it might be practical supports, that broad range of what we count as support. This is a useful diagram in considering, how involved to be, because it really can be dependent on a number of factors. That being said, I know a lot of family carers and supporters would say they feel like they haven't had a choice maybe, or they feel they don't have a choice, and they, a person maybe has become unwell and they've stepped into this role in a more natural, organic way. But it's really important that if you're in a family care supporter role, you're realistic about what support you can provide and what is sustainable. So often when we're going through a period of crisis or illness, people can step in and provide a high level of support at that point in time. And very often, the person may get well and they may not need the support they needed at the beginning. But also sometimes caregivers can overcommit themselves at times through very good intentions, but it can be very difficult to sustain that level of support maybe for their own well-being. So it's important to consider and to use this time to think about what support is realistic for me to provide. What support would I prefer to provide? What does the person actually need, and what support do they want? And we'll be talking a little bit about having that conversation what other people are around, what other resources are available to us, and what are the consequences maybe in terms of the illness of helping or not helping in a certain way. So trying to access the formal supports maybe through the person's mental health team would be important in that regard. Just I suppose some information about, you know, what people ask for and what people say they want. So service users identify supports as people who care, who empathize, who provide validation, who don't have it all figured out, who listen and share, so there's a balance within the relationship, who are prepared maybe to advocate for you if you need it, and can make a decision and take action on your behalf when you're not able to do this for yourself. And often that involves, you know, discussions with the person in terms of their preferences and what they would like in terms of their care and treatment. And ultimately, people say the most valuable thing a supporter can do is to listen. And Niamh will be talking a little bit later about validation and the role of validation in supporting people. It's really important to remember, though, that every experience is different. Everybody's individual mental health recovery journey is different and unique. And with that, every family and relationship is unique and different. So while we know that these are generally the experiences, it's important that we recognize that your own circumstances may be different, and as is everybody's. So one thing I suppose to mention is that sometimes family roles can undergo periods of change in times of illness or crisis. And possibly families might need to adapt to new or increased responsibilities, to practical lifestyle changes, and maybe some disruption to their own social and leisure activities. So we know that this can have an impact on family members when they have more to do, or, you know, more worry to carry in terms of their loved one. Often people talk about a pressure to be alert for monitoring the individual's well-being, and that can cause huge strain and anxiety for the person in a caring role. And there might be particular difficulty, for example, in children and assuming adult-like roles maybe, but certainly stress and tension in relationships. But it's also, again, as every family is different, different members within a family have different roles, and so the changes might be different for everybody. So what it's like for you as a spouse may be different to what it's like for somebody as a sibling, maybe a child of an adult parent, maybe a child under the age of 18, for example. And the most important thing is that you take time to identify what your own support needs are that are unique to you. And very often they can fall into a number of different categories. So I suppose one thing that we often know is that family members and carers really struggle to have access to basic information about mental ill health. So we know that comes up again and again, and that's part of why we developed the family webinar series, is trying to improve that access. We also know that people talk about being a carer, maybe the impact on the wider family, the worries that they have for their loved one and the future, and maybe personal needs. So they're some of the areas that people identify their own support needs. But it's worthwhile taking this time to think about what you might need and what might help you in this role. We're going to talk now a little bit about how you might look at doing that and how you might look at caring for yourself. So I'll stop sharing and I'll hand over to me.
Oh, it's just saying I can't share host disabled attendee screen sharing.
Okay.
Sorry, I'm not very techy. Sorry, no. Let's try it again.
Is that working for you there?
That is, yeah, brilliant. Great. Can everyone see that? That's okay to see, is it, Elaine?
That's okay. Yeah.
Brilliant. So hi everyone, thanks Elaine for passing over there. So we're just going to be talking a bit just around caring for yourself, because I suppose we get so caught up in the caring role that this is probably the last thing that we ever think about, that care for ourselves. And I suppose it is just, you know, a priority, and it is something that we need to look at and to factor into our week, really. I suppose firstly, there's really tending to our emotions. So taking that break to restore your energy, you know, that might be 10 minutes in the morning after the school run, staring out the window with a cup of coffee. You know, you might sit down in the evening just to watch the soaps. And I suppose sometimes we get that feeling of guilt, don't we? That, God, I could be using those 10 minutes to put on a wash. I could be up with the kids. I could be doing something. But I suppose it is just remembering it's so important to take that little break just to restore your energy, get your mind in check. Just that rest really is important, and it's trying as best you can to alleviate that guilt and to factor that rest time into your week as well. The second one then is managing unrealistic expectations. So I suppose sometimes we set ourselves up to fail almost, don't we? You know, if you're working from home, the kids are all off school, you know, the house is crazy, and you're saying to yourself, okay, today I'm gonna strip the beds, I'm gonna clear out that spare room. You know, it's really, it's almost impossible to be able to do all of that in at once, you know. So it's being realistic about what you can achieve in the day, you know, and I suppose prioritizing, saying, okay, this needs to be done. Everything else can wait. The house might be a mess, but you know, it's being realistic with yourself and realizing what you can achieve, what you can't. The third one then is observing our limits and managing our boundaries. So we'll talk a bit about that as we move on. But I suppose it's really just putting that boundary in place to protect ourselves, you know, working out what our limits are, what will I tolerate, what won't I tolerate, and observing that and keeping in check with that, and learning to say no, and realizing that that's okay as well. That doesn't make you any less of a, you know, a family member, or doesn't mean that you love them any less by being able to observe those limits and those boundaries. Then there's really developing your own support system. So I suppose it does become, you know, you're so, I suppose, enthralled with the carer's role that everything becomes about them, doesn't it? And you know, it's important that you have your own support system as well, and that you have someone that you can go and speak to, that's not all about the family or your loved one, but it's about you. And I suppose you tend to your own emotional needs. So it's important just that you have that system for yourself as well. And then acknowledging your own natural reactions and deciding how best to deal with these emotions. So there may be a day where you're stressed out, you say something that you regret, you act in a way that you wish you didn't, but it's reminding yourself that this is natural, this happens, you know, you're going through a really difficult thing, it's a really difficult role, and allowing yourself to do that and learning from that, I suppose, and just showing yourself that bit of compassion. And self-compassion is something that we will be speaking about just as we move on as well. So minding your own emotional vulnerability. So recognizing the signs of stress, so including feeling tired all the time, frequent illness, maybe poor sleep, maybe you're feeling a bit more irritable than you normally would, not enjoying the things that you used to enjoy. So I suppose these are all signs of stress and ultimately burnout. So as Elaine had mentioned at the start, we need to care for ourselves first before we care for others. So it is that idea of putting your own life jacket on first. And that really involves, you know, taking care of any physical illness. It might be this kind of headache that you've had for a few weeks that you've just kind of said, I don't have time to get that seen to. It's prioritizing time in the week and saying, no, I need to look after myself. I need to go get that seen to. Eating well, it could be sometimes eating it all. You might get to the end of the day and you haven't even sat down to eat a meal. You know, so it's so important that you get your nutrients, you get that into you, and you get that, you know, you look after yourself from that perspective as well. Accumulating the positives then as well. It can be very easy at the end of the day to look back and say, oh, I should have done this. I did this when I shouldn't have. I said this to such a person. You know, we forget sometimes the positives that have happened during the day. You know, there might have been some progress in one area of your life, and it's important just to acknowledge that. So I suppose it's human nature. We tend to look at the negatives, don't we, and what we could be doing better. But it is important just to look at what we achieved as well throughout the day or throughout the week. Then of course getting enough sleep and exercise, you know, with sleep, getting into a good sleep routine, you know, going to bed at the same time, getting up at the same time, and maybe trying to factor in that wind down time in the evening as well, so that it's not chaos until you go to bed, because it's really hard then to switch off. But just having that rest time before you go to sleep. You know, exercise, even if it's a 20-minute walk, just getting out to clear your mind more than anything. And then the coping ahead, so the what if plan. So, you know, making a plan in your mind that if this happens, what do I do? You know, if you know, my mother isn't around to help with the school run, who do I ask? What do I do? I suppose just to help plan ahead if something does go wrong. And again, then making time for yourself and other relationships in your life. So it could be a sibling, a parent, a friend, you know, and really factoring that in and making that time for that relationship as well, and letting that develop. And again, then being kind to yourself. So we do talk a bit about self-compassion as we move forward, but just, I suppose, acknowledging the difficulties and the difficult role that this is, and being kind and compassionate to yourself. So looking then at self-validation. So what is self-validation? So it's a distinctive skill that focuses on accepting the emotions you're experiencing. This can result in difficulties validating your own emotions. So you might feel sad or angry about something that happened around you, and you immediately tell yourself, I shouldn't feel like this, I should know better. You know, why am I feeling sad? This is silly. So on top of your primary emotions, you'll build other negative secondary emotions as a response. So really what the secondary emotion is a reaction to this primary emotion. So you're not actually reacting to the event that happened, you're reacting to this primary emotion. And again, this can be very exhausting and an uncomfortable process. So I suppose learning to self-validate your emotions will help you cope with the overwhelming emotional process. So how do we self-validate? So I suppose the first step is acknowledging the feeling, so naming that feeling. And that can be difficult, you know, knowing what it actually is that we're feeling. So right now I feel frustrated with myself. So step two then is allowing yourself to feel this way. And this can be more uncomfortable, I suppose, when it's the negative feelings, because I suppose we're very good with allowing the positive and the happy emotions to take over. But when it comes to maybe the more uncomfortable emotions, we maybe don't want to allow those in. But I suppose we have to allow ourselves to feel however way we're feeling. It might be uncomfortable, but I suppose reminding yourself that right now that's what it is, and I just have to allow myself to feel this way. And then step three is the understanding. So I'm frustrated with myself because I haven't cleaned the apartment in 2 weeks. I'm not going to judge myself for this because I've been feeling very lonely and mildly depressed. That's enough negative feelings. I don't need to make it harder on myself. And for starters, today I'll do the laundry. So again, then instead of jumping in that, you know, I'm going to gut the house completely and the whole place is going to be clean, start small, you know, manageable tasks, and saying today I'm going to do this and this will help. You know, it's starting small and it's getting one thing done. But I suppose you don't need to be adding further, I suppose, negative feelings onto yourself. So looking then at invalidation versus self-validation. So invalidation, you know, examples of this can sound like, I'm fine, I really don't even care about this, I think I'm just too sensitive sometimes, I don't have a reason to feel sad right now, I just need to get over it, I shouldn't feel upset, I'm such an idiot for being angry and I'm overreacting. So as you can see, it's all very blame focused, it's all very, I could have done this, why didn't I do this? It's all kind of pointing the finger towards ourselves. So I suppose looking at the self-validation can sound like, I did a great job with a project today. It's okay that I said no to that person. I understand why I feel anxious about this situation. Today is hard for me and I don't feel like myself. So again, with the self-validation, there's that bit of understanding there. So naming that emotion and understanding why you're feeling that emotion and showing some self-compassion to yourself about why you're feeling that way. So moving on then to developing a self-care plan. So your needs as a carer or supporter, they're obviously individual to the situation that you find yourself in. And again, no situation is the same. Everyone's is different. And this may change over time and develop over time. You may have already easily identified what you need to keep going, but I suppose it can be helpful to identify a self-care plan that considers best how to support your well-being and how to proactively manage stress. So when it comes to self-care plans, there's no one-size-fits-all options. As we said, you know, everyone has different needs, everyone's situation is different, everyone has different strengths and limitations, so everyone's self-care will look different. But it really can be helpful to consider and then the following 4 steps. So first of all, evaluate your coping skills. So how do you typically deal with stress? Is it something that you face head on? Is it something that you tend to move away from? And are you able to identify them when you need to take a break? You know, are you good at saying, no, I've had enough for today, I'm going to leave that? Or do you typically kind of go on and on until you get to the point of burnout? So I suppose that's the first step, evaluating where your coping skills are at. Then identifying your self-care needs. So what are you doing day to day to support your overall well-being? If you think back over the week, were you doing anything to support your overall well-being? And that's a good activity to do, to even think back from, you know, from last week and write down, you know, what did I do for myself? What did I do to support myself? And you might find there's very little there, and I suppose that's a sign that maybe it needs to be worked on. And then the barriers and areas for improvement. So what's working? There might be things that are working, there might be supports in place that you find really helpful. But then again, what needs to change? What can I do to help myself more? What barriers are there, and how can I overcome them? And I suppose then it's creating that self-care plan. And a lot of people find it helpful to have that written down somewhere so that you can kind of reference back to it then as well. So identifying your support needs. I suppose it's about asking yourself, what kind of support are you missing? You might find that you're able to ring some of your friends and you get the emotional support, you can talk things through, but maybe when it comes to the practical support, that might be something that you're missing. So what are you happy with, and what would you like to change? So some people, I suppose, maintain the same set of friends, co-workers, and contact with family members over their entire, lifespan. And sometimes we can think that we have enough support, but there may be certain times in our lives or certain events that can occur that we need to adjust, I suppose, certain aspects of our social support. So it might be that you have loads of friends from school or college that are really good at listening, and you can pick up the phone and speak to them, but maybe it might be the practical side of things that you need someone kind of close by that can pop in when you need that. So I suppose it's identifying what type of support really is that you need. It's important then to recognise that there are lots of different kinds of support, and your needs may change depending on what's happening in your life. So I suppose it is a process, it develops, it doesn't just stay the same. So moving on then to self-compassion as a support tool. So self-compassion really is about being kind to yourself, even when things don't happen the way that you expect or the way that you want them to. So it's really about being aware of your feelings and treating yourself with the same warmth, care, and understanding that you give to someone you care about. So really, I suppose it's if your close friend or family member came to you with the same problems or issues that you have, how would you speak to them? Would it be different to how you speak to yourself? And if it is, I suppose it's looking at that then. So it's also acknowledging that struggles and challenges are a part of life, and that everyone does go through them. It does, I'm sure, feel isolating and lonely at times, and it does feel like you're the only person going through these. But I suppose it is remembering that there are other people in the same boat, and it's important then to have that support. So self-compassion can bring great benefits to our mental health and our well-being. Particularly, self-compassion can soothe our soothe system, which calms our threat system. So this is a system then responsible for detecting potential dangers, and that's really there to protect us. And our drive system, this is that spurs us on to get things done and is supposed to be active in life. But really the soothe system kind of, operates to activate that and to calm those down so that I suppose we're compassionate to ourselves then. So they're just some guided practices that you could maybe have a look at afterwards. As you can see, some of them are quite short, especially with the meditation, the mindfulness. Sometimes people jump in and try to do the 20 minutes mindfulness or meditation, and it is really difficult. It really is a skill. So it's sometimes just starting small, maybe picking the 5 minutes, the compassion break, working on that and seeing how you go and building on that. And then just some exercises, as we spoke about, how would you treat a friend? Would you speak to yourself in the same way that you would a close friend? Exploring compassion through writing. Some people, speak about journaling can be really useful, and it is a proven technique, to help self-care and mental health. So that's definitely something to consider. And people also, kind of write letters to themselves, to their future self, their past self, and just showing that compassion really as well. So just a few exercises if you have time, I suppose, as well. So I suppose the positive statements then. So positive statements really encourage us and help us to cope through distressing times. So we can say these encouraging words to ourselves and be our own personal coach. So it's important to remember we've all survived some really distressing and difficult times, and we can use those experiences to encourage us through the current difficulties. So examples of coping thoughts might be to stop, sometimes just stopping in the moment and taking that time out, breathe and reminding yourself that you can do this, reminding that this too will pass, that you've gone through something like this before and it's over, and the same way will pass. I can be anxious, angry, sad, and still deal with this. So allowing yourself again to feel those emotions, that anxiety, that anger, that sadness, but still you can still manage this and you can still deal with this. I've done this before and I can do it again. Reminding yourself that these are just feelings, they will go away, and that this won't last forever. It's just, oh, there we go, sorry. Then looking towards developing our wise mind. So really, I suppose our mind, we have three states of mind. So we have our rational mind, and I suppose that's when we approach every experience very intellectually. We'll use facts, research, planning. It's all very rational. It's all very based on logic. You know, we'll use knowledge and past experience, and we're very focused in our decision making. Then moving towards our emotional mind. So I suppose when our emotional mind takes over, this means that we, you know, approach experiences very emotionally. We'll base all of our decisions on our emotions and what our emotions we're feeling at that moment. We tend to be very reactive rather than responsive. And again, we'll tend to react on whatever emotion it is that we're feeling in this moment. And we'll kind of use our core psychological needs then. So I suppose we all kind of move towards rational and emotional mind at different times. But I suppose really where we want to be is our wise mind. And really the wise mind is this balance of the rational and the emotional mind. You know, we're using our emotions, but we're also using logic, and we're also accessing our rational mind at the same time. We're, I suppose, using our intuitive experience and thinking, and really we're living mindfully, and we're using our relationship mindfulness. And that's something, again, that we'll come to in a moment. So observing your limits. So I suppose observing our limits is different from setting boundaries. So boundaries are often used as a loaded term. And it's important then to remember that circumstances make a difference. So it does matter whether someone does something to you deliberately as opposed to behaviour maybe that's due to normal accidents in life. So I suppose with our loved ones, our family members, if they're having a difficult time, it can be really hard to know when to set limits and when to get that balance of, I suppose, drawing the line between enabling them and avoiding burnout, because I suppose we want to be supportive to them, we want to help them, we don't want to see them in distress, and we want to be there for them, because at the end of the day, you know, you love this person, but at the same time, we don't want to be that enabler. We don't want to be enabling them to lead this lifestyle, and we don't want to I suppose, to create burnout for ourselves. So it is about getting that balance right. And it's remembering then that your limits may shift over time, and that's human nature. So, you know, they may shift from time to time, from person to person, and that's, I suppose, that's the way they operate. So observing your limits then. So really observing your limits will help reduce burnout. So for you, if you're able to put these limits in place and to realize that it's okay to say no, it helps it helps reduce burnout from yourself, because you're putting that limit in place to protect yourself. It helps preserve the relationship, because I suppose what happens is, if we don't have limits, if we don't have boundaries, what happens is it leads to resentment, because we sometimes feel taken advantage of. We sometimes feel that we're always saying yes, we're always doing things for other people. And that leaves us with that feeling of resentment towards the other person. And again, then it helps preserve your sense of self, and I suppose your sense of respect as well. So how to observe your limits. So really it's about identifying what you're willing to accept. So what behaviours will I accept, what behaviours won't I accept. So identify then what goes beyond your limit and your sense of self-respect. So asking yourself, was my self-respect threatened there? You know, am I prepared to accept that? Am I not? And accepting then that it is okay to say no as well. That doesn't mean that you love the person any less. It's just about protecting yourself in this moment. So identifying and communicating a limit then. So firstly, what we do is we identify the limit. So what is my limit here? It might be that, you know, I don't want to have this conversation if voices are raised, if you're shouting at me, whatever the behaviour is, it's identifying that. So observing your experience and defining this to yourself, and then notice whether the limit has been crossed. So in your mind, noticing, has this limit been crossed? And I suppose in that moment, then you decide whether to communicate that the limit is crossed. So it may be that you decide at this moment in time, I don't feel the need to communicate that the limit is crossed, I'm happy enough. Or you may decide, no, I feel like myself, my respect and my self-respect was crossed here, so I do want to communicate this. So really what we do is we communicate the limit. So we tell him or her that you're going to end the conversation if you don't stop shouting. So what you're doing here is you're giving them a chance to modify their behaviour. You're telling them what's going to happen if they don't. And really what you have to do is you have to follow through then with that limit. So I suppose it's ending the conversation then, and the follow through is really important. And I suppose while you're doing this, it's validating and soothing your loved one about the limit, you know, so telling them, I know this is really difficult and I know this is not what you want, and assuring them then that you will be available at a different time or for a different issue. So, that validation piece, and which we will move on to, I suppose, later on, and assuring them then that you will be available at a different time. We can talk about this tomorrow. Just right now, I'm going to end the conversation. So I'll hand you back over to Elaine. Sorry, now.
Thanks, Niamh. So it's really important that we think about not only how we care for ourselves, but also talk a little bit about how you support the person in your caring role, because very often we'll say to family members, are you looking after yourself? Where's your self-care at? And they'll say, look, I just need you to look after the other person. Once they're okay, I'll be okay. But we know it very often doesn't work like that. And also we need to keep the balance of giving people information about how to support people and what might be helpful for them. So I suppose the first starting point is always talking to the person directly about how to help. This can be a really difficult conversation to have at times, but it's so important that you start with what the person feels comfortable with, what they want, and what they identify as being supportive or not supportive. We're not used to having those conversations. We're not used to approaching support in that kind of technical or formal way, but it can be really helpful to have frank and open discussions about how you can help, what feels maybe beyond your limit, what you feel comfortable with, and what you could bring in other supports to do. The timing of that discussion is really important, because the person might not be able to do that in a time of crisis, and so it may be best to do this when a person is relatively well and when they themselves is ready to have that conversation. But to keep the lines of communication open, whilst also avoiding conversations that are dominated by illness, which can be a tricky thing to do, but it's always important that we keep that in mind. And also just using language that feels comfortable for us, and being as direct as we can, even though maybe pre-existing relationships that might not always be that comfortable, but we know that this can help us to be as effective as we can be in getting support and receiving support. One thing I suppose we'll often say is accessing timely and quality information can have significant benefits to you and your loved one. So it can help you identify what your role is and what your role isn't, and how your loved one's recovery journey may go, even though that can be very difficult to predict and is often very unique. But it's important that you have basic facts and information. Sometimes that can be challenging to get, as we mentioned earlier. Sometimes information might not be shared. Maybe that information isn't provided at the right time, or issues may change or overlap. So we know that can be one of the difficulties in modern psychiatry, is that there is an overlap. A lot of conditions overlap, and it can be difficult maybe for your loved one to get a diagnosis, for example, and therefore difficult for other people to get the information they might need. Also, it's really important to remember that we learn best when we're not stressed, we're free from distraction, and we've plenty of time. This is generally not the experience of anybody in a caring role, or particularly maybe if you're in contact with mental health services or inpatient services. In terms of general resources for information, these are some good sites to think about. So Rethink, Mind, the Royal College of Psychiatrists website. In terms of HSC, the Family Connections Programme is a particular resource for families supporting somebody with a diagnosis of borderline personality disorder, but they have lots of good video material. And then with things like, for younger people, Cope MySpace, there are websites that can be helpful if you have a young person or child in the family that might need extra age appropriate information. I suppose getting that information can help sometimes with communication, not all the time, but it certainly can help. One of the biggest things, I suppose, in terms of aiding communication can be managing emotional states. But we know that can be difficult, because often when an illness comes through the door, communication goes out the window. So we often stop communicating to each other in our normal ways, maybe due to fear and worry. So our emotional arousal is up, so that makes it much more difficult for us to communicate maybe in a clear way, or in a way that we get our message heard. So good communication is really key, and practicing this is really important. But again, the first step in good communication is also being mindful of our emotional state. So that goes back to what Niamh was talking about minding your emotional vulnerability and taking care of yourself so that you're in a position, a steady enough position to communicate and respond rather than react. So some of the keys to communication would be active listening, calmly expressing your feelings, and communicating about positive things as well. Some, I suppose, overview tips, and these are the things that are good for us all to keep in mind and universally thought of as good things, irregardless of the situation you're in, but definitely can be useful and applicable in a caring role, is delivering your message to the attended person. So not going around the houses to try and communicate a message, going straight to the person that you want to give the message to. If one thing you take away from in terms of communication is using your I statements, so I feel, I think, I need, I want, and that really helps us to take responsibility for our feelings and to own that message, and then it's much more likely to be disputed, because you know your feelings are your feelings. To be as specific as objective when we're describing a behavior and a situation, and if at all possible to avoid you always or you never. As very often that doesn't help us to be effective in communications or get the message across, because we'll immediately get a defensive response going up. These are some other suggestions. It's just being specific about the action that you're requiring from a person, only addressing one issue at a time, acknowledging the other person's feelings, and being mindful of our body language and our tone of voice, because that can completely change a message. And we know that 55% of our communication is our body language. So keeping that in mind in terms of how we speak to those around us. So I'm going to just pass you over to Niamh to talk about validation skills, which is a very important skill for family members and carers to think of in terms of their support role. Would it be easy, Niamh, if I kept the slides on here?
Yeah, maybe. Sorry. You can hear me okay, can you?
Yeah.
Brilliant, yeah. So just moving on to validation and validation skills. We kind of touched on it earlier. But I suppose really what validation is and what validating is understanding what the other person is saying or feeling, and also communicating that understanding in a clear way. So letting them know that you understand where they're coming from. So I suppose validation decreases the emotional arousal. It brings our emotions down. It decreases our defenses. It communicates compassion and understanding, because really that message that you're getting across is, I get where you're coming from. I know this is really hard for you. It makes problem solving easier, because I suppose our emotions are less. Sorry. I'll do something there.
Oh, sorry.
No, you're okay. So I suppose it makes problem solving easier because it brings our emotions down. We're not as heightened, we're not as emotional, so we're better able to look at these problems and come to a resolution. And then it really builds trust, and I suppose it slows negative reactivity, because again, our defenses are down. We're not as defensive. If someone starts a conversation with, I know this is really difficult, we don't tend to kind of get our back up. We tend to kind of listen a bit more, so it reduces that reactivity. And I suppose validation may seem straightforward, but it can be difficult in the moment, really, can't it? When you're dealing with intense emotions, when everyone's emotions are heightened, it can be really difficult to remember to use those validation skills. And then often afterwards, what we do is we invalidate ourselves by being judgmental of our own skills. So, maybe you said something in a disagreement with your family member or loved one, and afterwards you're kind of saying to yourself, God, I should have done this, I should have done better, I could have said this. But I suppose that's really where the self-validation piece comes in, and that self-compassion that we spoke about earlier. And it's so important to validate ourselves as well as everyone else. So kind of saying to yourself, I'm not going to get this right every time. That was a really difficult interaction I had with my loved one. I need to be kinder to myself. So it's remembering that you need to validate yourself as well as others. So that moves us on then to the whole idea of relationship mindfulness. Again, we kind of spoke briefly about that earlier. So relationship mindfulness really is being mindful of another person or your current conversation with that other person. And I suppose really what that means is paying attention to him or her, getting and staying balanced, and really keeping in mind the relationship that you have with them, and the person, I suppose, that they are, and remembering that anything you do or say will have an effect on this relationship and on this person. And it's remembering that in the more difficult, I suppose, disagreements or conversations, remembering that anything you say in the short term can have that long-term effect. And it's really, we're aiming to be effective rather than right. A lot of the time we'll go into conversations or disagreements and our whole aim is to change the other person's point of view so that they'll agree with us. And we're almost kind of waiting for the person to stop talking so that we can get our point across, and we're almost not listening to what they're saying. So I suppose really it's about being effective rather than right, moving away from the idea of winning an argument and moving towards that effectiveness. And I suppose relationship mindfulness then it's responding rather than reacting. So it's reducing our judgments, it's recognizing our primary and our secondary emotions that we spoke about earlier. So, if you find yourself getting angry or frustrated, taking that step back and saying, what's the primary emotion here? Am I sad? Am I worried? And bringing it back to that and trying to work off the primary emotion rather than the secondary emotion. Decreasing that. So I suppose when we respond to our emotions, what we do is we decrease our emotional reactivity and we support our emotional vulnerability. So I suppose we bring our emotions down, and in turn the other person kind of mirrors that, and the hope is that their emotions, I suppose, regulate like ours do. So really, relationship mindfulness is being aware of the longer term relationship goals and desires as a parent, a spouse, a child, a partner, a friend, whatever that might be, and try to avoid focusing on the short term. So when you're in that moment, try and avoid that short term of I need to prove that I'm right here, and I suppose think about the longer term goals that you have here and that person that you love. Experience yourself in the context of the other person and the other person in the context of you. So again, that's that idea of balance, getting and staying balanced, and then acting from this context and knowing when to let go. So knowing when the conversation has kind of come to an end as well then. And then problem solving. So knowing what you want. So I suppose it's starting off, but what do I want from this? Do I want to improve the relationship? And using your mindfulness then to identify what you feel, what you think, and what you want from this. Asking yourself, is the time right? Has it been a long day? Have you both had difficult days? Is it late at night? Is it first thing in the morning? Working out, is it the right time? Can your relative handle this right now? Have they had a really difficult day today? Has something else happened that's annoyed them? And if you feel that maybe they can't handle it, it's about waiting. But I suppose if you find that the timing is right, tell the other person what your goal is. So my goal really here is to spend more time with you, more time that we're happy together and improve the relationship. And I suppose obtain an agreement on that goal, because often the goal will be the same. You both want this relationship to improve and to be there for each other. And then it's proceeding with that. So what you're doing is you're starting on something that you both agree on and working off that then. And then I suppose just to finish off, just specific family supports. So we've just listed a few there. There's Bernardo's, to Slip Family Carers Ireland all offer, family specific supports. There's Recovery Colleges, Aware. There's Alzheimer's Ireland, Parent Line, Safe Ireland, and Shine. And what I would say, I suppose, is your community mental health team as well may have supports in the locality. And often your public health nurse that's attached to your primary care centre will know of supports that's in your locality as well. So they're a good resource to have.
I think because I'm sharing my screen, I'm not able to see the Q&A, but I'll go out and check this now. But before I do that, I suppose it's important that just an important message, I suppose, for those of you who may be carers within the audience. If you are a family member who has used or is using mental health services, and particularly those who might be familiar with the St. Patrick's Mental Health Services, we are seeking support and opportunities. We're looking for family carers and supporters to join our service user and supporters network, and there's also a particular call out for carer volunteers who might be interested in getting involved in the new academic institute that St. Patrick's Mental Health Services is launching. So there's lots of opportunities to get involved and to have your say and to contribute. If you would like to do so, please feel free to get in touch with our service user engagement coordinator or via the support and information line. But that's an important message because we really value that involvement, and we're really keen to get more families and carers involved. Also, just to mention, if you'd like to attend any more of the family webinar series, we'll be taking a break next month, but thereafter we've got another couple lined up for the rest of the year that might be of interest to you. I'm going to come out of this now so that I can see if there's any questions or comments. So just a question: how can a carer communicate when they have a concern and feel that it's not being heard, and how they manage the anxiety of not knowing how their loved one is if their loved one has not given permission? Yeah, absolutely. That's a really great question, Gary. And one that we encounter quite a lot is that very often, and I know I've mentioned that at the beginning, that very often people don't give permission to be shared. And I suppose it's trying to remember that you can information if you would like. Don't allow. There's just a bit of an echo. There. Yeah, apologies. So I suppose one thing to remember to start with is that you can always provide information, even if you can't access information. Maybe if the person is going through care and treatment. And I suppose it is about what can be really difficult about this position is being in that helpless, powerless position of wanting to help, but not knowing how best to do that. And the hardest thing in that situation can be to look at our own emotional vulnerability and look at how we can manage that anxiety and recognize our own limits, and just letting the person know, I know you don't want me involved at this point in time, or I know you're not comfortable with me sharing information, but I'll stay in the background and I'm here if you need me. And let me know what it is that if I can do something, you know, what feels comfortable for you, what feels, you know, at your limit, and trying to have that open conversation, because I suppose, as we mentioned earlier, that's something that can shift and change over time dependent on where somebody is at in terms of their individual recovery. And it may be, even if this is an ongoing issue in your relationship, to asking, you know, is it a possibility that I could have a family meeting, or are you comfortable with me giving information, or could I speak maybe with the social worker on the team to get some specific advice unique to your situation? But certainly it's a really difficult position for family members to be in when information is not shared. But again, you know, the importance of just revisiting that conversation and having an open door where possible. So there's no other questions that I can see so far. So I think we'll finish there for this evening, right on time. And as I said, the webinar will be recorded, and so it'll be up on the website in the coming days. And I thank you all for coming to join us this evening. Have a good evening. Bye-bye.
Thanks, everyone.